And welcome to First Friday Fertility Live. I'm Dr. Perry, and I've got Vicki joining me at a distance. We've got, again, still keeping the social distancing and everything for, the First Friday Fertility, as well as everything that we do for care. We're still in that COVID era, and the latest estimates suggest that it may be even 2 years before things sort of normalize a bit. We will see, but we are here to support and protect you as much as permissible under guidelines. Um, Today, we're going to do an exciting topic, which I've meant to do for a long time, which is egg donation. This is an important topic for many couples and many women who want to become pregnant, where, again, because of where their ovaries are from age or from medicine, from either the fact that their ovaries didn't work as well or as quickly as they wanted, or because, for example, they had chemotherapy, or because they had surgery where they had cysts or their ovaries removed, or various other issues. It can affect so many women who want to become parents. And so we're going to do some of the ins and outs and the basics of sort of becoming an egg donor, as well as what it's like to also be a recipient of donated eggs. And we'll go in all of that. The top questions I want to go into for the donors, they say, okay, how do I get fairly compensated for my time and everything? How do I go about it? Am I eligible? And Vicki's going to talk a lot about that. So I'm going to bring her in a moment. We'll swap seats so we can still keep the 6 feet. And the mask issue so that we're, Vicki had actually a cutout mask where you could see the lips move for things. It was hilarious, but I just thought that was a little weird. We'll talk about that for the donors as well as for the recipients, who I think, the top question for recipients, beyond, again, the issues of privacy that surround this, they also want to know, okay, is this really my baby? And that's a complex statement, but we're talking about what are the genetic contributions and other contributions from the biologic mother or the woman who's carrying the pregnancy relative to the contributions, hey, Brittany, from the contributions from the person who donated the egg. And is that relevant, and how much does it matter? And so we'll be talking about all those issues. I'm going to switch over to Vicki, so we're going to rotate seats for a moment, and she's coming in. Just 1 second.
Hey everybody, it's been a while since I've been on. I will try. Dr. Perry came in and talked, and I thought he's going to say everything that I was going to say in his 5 minutes before I get on. But welcome. I'm going to talk to 2 groups of people today. The first group is for prospective egg donors. You will pick up the phone, you'll call us, you'll email me. I'm Vicki at periscope.com if you might be interested in donating eggs. And you're probably going to ask a question, well, how do I know that I qualify? You will pick up the phone and just talk to me. Let's talk about some of the issues, some of the concerns that you might have in this whole process. Very detailed, very structured, and we try to impact what you're doing in a positive way here at Positive Steps. Egg donation is serious. It has a lot of positive things that come out of egg donation. It is a process. It is something that takes a little time to see if you qualify or not. You will fill out a pretty extensive history form for us, and that's important because this is how we are going to choose you for the process, but also to allow a recipient to choose you. They're looking for information that kind of matches who they are as a person, as a family. Dr. Perry, you can chime in anytime.
No,
I'm not used to being on here by myself. We have a lot of
People
fun.
would rather hear from Vicki than from me so much of the time. Everyone loves Vicki, so this is a good fit. And besides, my being in the background is a good way to go about for a lot of life.
We do have a lot of fun, and as I said, egg donation is serious. It's something to take very, this information in a very positive way, but also seriously, because we have to look at all of the aspects of you as an individual if you are chosen as an egg donor. It can be a very rewarding experience to know that there is a family that is out there that needs this completion for their life. And there's several things that can affect them having a baby. So they didn't choose this for their life. They didn't choose not to have a baby. But what they are choosing is to go a step further and to accept someone's egg that they will carry, and they will produce, hopefully, baby that fulfills their life in a very positive way. Two common, denominators here in our practice typically is the anonymous donor, and also a designated or dedicated donor. So there's two options here. You may have a friend that would, absolutely donate eggs for you, and that is a great thing. But they still have to go through the same process as our patients that are anonymous. The anonymity of all of this is very important to many couples. And I'm having a little issue over here.
Okay, swap out for a second, and I'll step in for a second as we get through the. Again, let's see. We'll just close out that screen here.
Sorry.
The antivirus wanted to remind us this was a very important time to, stay free of infection. And we do have to screen the donors. This is FDA screening. In fact, they actually treat this as single cell organ transplant for oocyte donation. So we take very seriously that screening. By the way, there are several things I was going to comment on, but actually I was going to let Vicki continue away with where she's going. So back to Vicki for a moment for this.
So we were talking about anonymity and all of this, and very important. And so you may have something you want to say there.
Oh yeah, actually, then I'll do that. Just swapping back and forth. We are doing a musical chairs approach
to P90.
Exactly. We're doing all our sit-ups and getting back in shape. We've gained our COVID 19 pounds, and so this might be a good way of working things out. One of the things on anonymity I just wanted to comment. At first, everyone wants to be anonymous, but if you use a known donor, especially when people use family, it's wonderful to have the overlapping genetics. But two things happen if you use an egg donor from a family member. One, they may have the same problems that led to a woman having diminished ovarian reserve in the first place. The other thing is you want to have the right counseling and evaluation beforehand, because sometimes the relationships can be constrained or shifted as a result of the egg donation. For example, though your sister donates eggs to you, and you then have that child, and 5 years later, the kid is acting up around the Thanksgiving table, and the sister feels entitled to comment on your parenting skills in a way she might not otherwise, simply because she contributed to the child. It can make for some interesting tensions, and you want to be prepared or aware of that if using a known donor. At the same time, an anonymous donor is very doable. And in fact, actually, eggs are a little bit different. Sperm is just an aside comment. It is so much easier to use an anonymous sperm donor than a known sperm donor, but that's a whole nother story for things. Anyway, I'm going to give it back to Vicki for things, and I'll continue interjecting and commenting because it's hard to shut me up, but we will end up having lots to say.
Okay, back. So as you go through this process, it is very, we will provide instruction for all this, and it will help that patient, to fulfill their lifestyle dreams and to have a baby. Thank you for participating with us in the past if you have. I also try to instruct, our prospective egg donors. We don't talk a whole lot about this through Facebook and things like that. And part of that is it's not always accepted in your group of people that you might be with. So keep that in mind as you're sharing that, oh, I'm an egg donor for so and so, for a practice or for another group, because this is something that's very personal from the standpoint of our recipients. And you want to protect their, feelings in this whole process. Fertility brings on a lot of complex psychological issues. And so that's something else that you are prepared for in this process as well. You're given part of yourself to someone else to develop a baby and to have that baby. And we could previously say this is totally anonymous, but just to realize that there are new DNA testing that is done, and it can affect 20 years from now, recognizing that there could be a connection somewhere in that information that is provided. So that's something to keep in mind as you're, as a recipient, you've received an egg, you have an offspring, and then that child at 20 or 21 could have that test and could potentially go back and find, potentially that egg donor. So I think open communication as that child ages and as that child progresses through life is an important part of that psychological process. Psychologically from the parent standpoint, also from the child. And then you also have to look at any siblings that are part of that. Dr. Perry,
Yes.
am I going too far?
No, you can go into this. Do you want me to tag in? And say
Please
something?
do. Come on, get over here.
I'll do a bit, but again, the musical chairs approach. We're going to find a groove at some point for all of us. So there's several things that I want to say for that. First, I think, yes, you want to, I always say that for egg donation, the anonymity is critical. We won't give out information. We follow HIPAA guidelines for things like that, but there is the degree to which technology is changing. With Ancestry.com, you used to send in just what you knew about your parents. Now you send in a cheek swab along with it. And this is how people are finding out, oh my gosh, they sent in the information for the Golden State Killer and end up tracking it down. I think 20 years from now, a lot of people will be able to walk into a CVS and find they're related to a mailman just because of how the technology is evolving. But at the same time, I think that will be a more normal process. So we definitely want to think about our protecting privacy, but then also that society is changing on things. Another thing for the egg donors, I think they want to know about is, for all the efforts, what do I have to do? And beyond filling out paperwork, how is this going to, take time for me? And we usually have to do an exam. Well, we always have to do an FDA exam. A little bit different. It's really checking for track marks to make sure people aren't injection drug users. We're looking for infectious diseases to avoid transmission. It's interesting. Even though we check for a heart rate and a lot of other things for broader health, the FDA is less focused on that relative to infectious things. And so it's a little bit different of a physical exam. Another thing people want to know about is compensation. And if eligible, usually it ends up being about $5,000 for the first time donating and $6,000 for subsequent times. And people can donate several times for this process. So it is very appropriately compensated as people go through this. Another thing that people want to know about with egg donation is sort of how many visits do I have to do? And again, I think I was going on that direction and then got on a tangent. But usually, again, there's the meeting visit, there's the physical exam as you get near the time of donation, and also we do an ultrasound to make sure that people have the right eggs and to finalize dosing, as well as teach on the medications. And then usually it's about 3 to 4 ultrasounds usually 4, to see how eggs, to make sure eggs are lined up and that they're growing appropriately. And then you'll give a trigger shot, which will release the eggs a little bit later. About to sneeze here, by the way. Great on live broadcast. By the way, exactly 6 feet away. And remember that sneezing is not associated with COVID. It's just associated with being in Mississippi during allergy season. And then also you do the retrieval, and that's something where you get anesthesia. You're getting high quality anesthesia where people are very relaxed from propofol. That's again it's called the top shelf medication, so to speak, and people tend to do very well in terms of going to resting and then awakening from it. And so there are a lot of things that can be done to keep people comfortable. You are bloated after doing IVF. Again, if you think you get 1 egg in a month, try 15 or more. There will be that bloating, but the bloating goes away. And so this is something where for doing effectively much of the intensity being a week of work plus a bit of recovery, and by this way, this is all FMLA covered, to make $5,000-$6,000, as well as to effectively change the world for a woman and a family, and to bring a child into this world that would not otherwise be here, that will be loved and appreciated and is clearly wanted. That is an amazing action, difference, contribution, and it is life changing. I mean, when you talk to these women, not only for the journey they've gone through to the point where they want an egg donor, but also after this child is born, and how just special and desired it. I mean, you're truly changing lives. And so I have so much appreciation both for the women who donate eggs as well as the recipients, because it takes a lot to realize that they are more committed to becoming a parent than they are to the particular origins of the DNA. That takes a maturity and a perspective that not everyone can achieve. And I have a lot of respect for the people who get to that point. And this is one of the things people don't often talk about. You have all these women who are getting into their 40s. And if you look at the media, everyone thinks, oh my gosh, well, all these women had their kids at 45, 46. And you look at Beverly D'Angelo, and you look at, Halle Berry, and like all these people in their late 40s having it. I can't prove whether they were their own eggs or not, but here's the thing, if you talk about success rates using one's own eggs in the late 40s as being 1% or less, when Cheryl Teague says that she used her own eggs to get pregnant at 51, I can't prove or disprove it, but the only way that makes sense to me is if by her own eggs she means she paid for them and they were her property. There's a lot of misconception in the media. In fact, I see all these people talk about their miracle child, and it was a miracle, but it was a miracle of technology. I was present at the conception. And so I kind of know what was done. I am so emphatically protective of HIPAA, and I believe in it. But I think also, as people often have ovarian reserve issues and then get pregnant, while you want to respect privacy, you also recognize there's so many people suffering in silence, and they think that too will be me as a miracle, when in fact, actually, what was taken to get there was very different from what they think for how they got to that point. And so I think a lot of people, when they have diminished ovarian reserve or premature ovarian failure, they, especially the POF, you often talk about a 5% lifetime chance of pregnancy, but especially the people who do have that 5% chance and end up being the ones successful, you often see that those were people in their 20s when it happened. And so while they lacked the quantity, they had some better chances for quality. And then you also see that there was more of a tendency towards autoimmune causes for things, where the autoimmune attacking the eggs can wax and wane, and they can go from having an attack to having it resolve, and they can do a lot better for things downstream. So there's it's not entirely random for that 5% lifetime chance. And so I think that's also very important. If you think you have diminished ovarian reserve or a lower chance, don't let anyone tell you definitively you need egg donation. You want to see what your ovarian reserve is, what your chances are, and have counseling. And a lot of these people also, I see a lot of women with diminished ovarian reserve, and they're shepherded or forced into IVF by some people, when in fact, the thing is, if you have diminished ovarian reserve, sometimes it's better to go an insemination rate relative to IVF, because if you get 2 or 3 eggs with insemination and you get 2 or 3 eggs with IVF, the increased cost in IVF relative to the increase in likelihood of pregnancy may not always make economic sense. So that's also something that you have to think about in this journey, and at least prove or have done a reasonable shot at making the most of your own body before moving on to an egg donor. That being said, again, I think from the donor standpoint as well as the recipient, egg donation makes a world of difference. And you can't imagine how many cute and beautiful and wonderful children are in this world as a result of that process. I've been doing a lot. Vicki, you want to tag back in with me, and then I'll see what I have to add. Usually I have a monologue and I'm going full direction down a particular way. And so right now we're trying to mix it up for the things that we talk about. And so Vicki's back in for things that are on her mind.
I was looking back over some notes that I'd written earlier, and it was interesting because I didn't know this earlier. And Dr. Perry, you may have said this, but 1983 was when the first egg donation process pregnancy started. And that was just, it probably started off a little slow to begin with. And hopefully at this point where we are now, things are very structured in our process, and we attempt to do this as quickly as possible, but following those guidelines that Dr. Perry had mentioned with FDA requirements and our requirements here at Positive Steps. Some of the reasons that he may not have touched on, may have, but of course, if you've had chemo in the past or radiation, that's one of the needs sometimes, that ovaries are not working like they should. So that's an area that needs to be investigated in this process as well, if you've not gotten pregnant and you've had those things that have occurred. Sometimes there's been a congenital absence of ovaries from birth, and so that's something that we can tackle through the egg donation process along with everything. So ultimately, I think one of the big key factors here is, number one, if you're interested, please reach out to us. This is something that is so needed by so many patients. Reach out by phone. You can dial the 601-202-4779 number and just give us a call and ask to speak to me, and we'll start the process. I'll answer any questions you might have and kind of prospectively look at you and say, hey, you might be a great candidate, or perhaps you're not a great candidate, but thank you for trying. That's a very positive thing. On the recipient side, for you to prepare in this process, open your heart up. Open the heart from the standpoint of receiving the information first, because that's all you can do. And then with that, then you can process through the next steps that it takes. We need to make sure your uterine cavity looks good. We need to make sure that where we're putting an embryo through this process is going to be positive, that it's going to be receptive to what we're doing. You are on a limited amount of medicine, estrogen usually, to get everything really optimized. And then you will start progesterone at a specific time, because we're mimicking what the body normally does to get ready for that transfer. And then 10 days after transfer is when you test to have a positive pregnancy test, we hope. And 60 to 80% of all, of most, I'll say, of our patients that do egg donation are pregnant. And certainly we would love to be 100%. But we haven't achieved that quite yet, and we move through all of this step by step and assess every patient. And really, throughout my nursing, you have to take each individual patient as an individual. Everybody is different. And so we just want you to know that we're here for you. We're trying to achieve those lifelong goals for you and with you, because this is a group effort. It's something that it takes, a team of people to make this happen. It's not one person, it's not two, it's a whole team. And certainly here at Positive Steps, we want to be that team for you. Dr. Perry, I'm going to turn this back over. Okay. I know I've not touched everything that we needed to touch today.
There is so much we've got to cover, but that's okay. And that's the thing. We will, when you do this sort of tag team approach, it can be a bit random. So I'll answer a few questions. So Tierson, you just posed one. How old is your oldest recipient? We follow ASRM guidelines, which use a cutoff of age 50 for things. And so our oldest was 50 and actually ended up delivering at 51 for things. And so, yeah, but I think it's also not just a question of age, but also wellness. The thing is, if you are, there are some 50-year-olds who are healthier than 25-year-olds in our state. And so that makes a huge difference for things. Another thing is, and so you have to do more screening, particularly as you get to the mid-40s, where you're looking for echocardiogram, stress tests. You want to do mammogram. Again, I'm passionate about breast cancer screening. My mother is a 30-year survivor. So these are all important things to consider because we want you not only to have a baby, but also to be around to enjoy that child as well. And so that's a very important thing. There were several other things that we were going to cover. And now all of a sudden, as soon as I sit down here, from having that list in my head, I'm going to a complete blank right now, but that's okay. I think another thing that people are wanting to know is, well, what happens for those embryos? If I transfer an embryo and I'm pregnant, can I then use those embryos for another child if I have extra embryos? And we see that done all the time. And so our goal is to help people with their family bearing. One of the things Vicki was quoting the statistics, 60 to 80% for pregnancy rates. The answer that's always right in medicine is it depends. But what we can say is it depends on whether you use vitrified eggs or a dedicated donor. If you have a vitrified egg cycle where you're having 6 eggs dedicated or 8 eggs donated, you're often in that 50 to 70% range. But if you're starting to get a dedicated donor where you get all the eggs from a single cycle for that person, it can even be in the 80 and 90% and above range, depending on the circumstances. And for instance, usually as long as there isn't a meaningful male factor, many people do very, very well with that and are often able to have multiple children. So the answer for all of this is ultimately it depends. But I think at the same time, for all the details and all the issues that are with this, we've covered a lot of ground. It's probably been more fragmented than we normally do. On the website, if you go to periscope.com, there is a page on egg donation there. And I'm sure it was much more structured when I wrote that because I can edit it and put portions together. And you can find out a lot of information there if you're interested. Or again, just call us. Again, Vicki gave the local number. I always give the 833 PAUSE STEP, POS for 767, STEP for 7837. So 833 PAUSE STEP. And you can call us and you can ask questions. We have people, coming internationally from across the country. This is something so you don't have to necessarily be geographically bound. We have people who can ship their sperm, and we create embryos and help with also gestational carriers, which is another topic. One of those things that, by the way, if you're doing a known donor or a gestational carrier, you really want good legal agreements to when there isn't the anonymity, or whether when a person is carrying a pregnancy for you. That's a whole topic in and of itself. We can help you, guide you to people. We are not lawyers ourselves, but we can guide you to people who are quite good in those issues. And ultimately, I think this is the most important thing that relates to so much of medicine. You don't have to figure it all out yourself. I always say to people, again, I lift the hood of my car, I can't find spark plugs, I don't look there routinely. This isn't something most people have had to done, and they're trying so as to get control over the process. They're trying to learn everything. But there are many things for which, as long as you have a team that is ready to communicate and is open and is transparent, and wants you to understand things, you can find out a lot, and you don't have to reinvent the wheel for yourself. And we will do what we can to help you on your journey, whether it involves egg donation, being a donor or a recipient, or any other aspects of the process. Let us know. I always say we can't fix what we don't know about. Good communication is key. We want to help you. Thank you, I think, for tuning in. Vicki, do you have anything else you want to add? Go for it.
I don't, but thanks for being here. We hope to see you soon and hope to answer all your questions. Thanks.
And we can't wait until we can actually just sit next to each other and do this without having this being a merry-go-round of who's in front of the camera. But at the same time, everyone stay safe, stay well. We're thinking of you out there, and we appreciate you for tuning in. God bless, and thank you again. Awesome.